Well, during an emergency situation, it is easy for parents to become upset, anxious, or even disoriented. Last week, you may recall 19 children were taken to the hospital because the levels of chlorine bleach in the water at fountains at World's Fair Park were just too high. Now, they were treated for skin and eye irritations. They took several steps, including quick action by hospital staff to make sure the children were, in fact, okay. 6 News anchor Lori Tucker joins us now live with much more. Lori?
Well, Kristen, doctors want families to know they have a plan in place. So during an emergency, it's really important for parents to have important information on hand to help doctors should something like this arise. And joining us now is Dr. Ryan Redmond from Children's Hospital. Always good to see you.
Thank you.
We'll get right into it. What are the hospital's plans for large-scale emergencies?
Well, we do multiple different things to kind of prepare for emergencies, all the way on small scales, all the way to large scale, kind of irritant exposures, things like that, like happened last week. We drill at least twice a year on major scale kind of things, and then also have plans in place for more extended kind of surge capacity, like a couple years ago when we had our pandemic flu.
Right, how to handle that, all the influx of cases coming in. Curious, what was the response time with this bleach incident at the hospital?
So with this incident, because World's Fair Park is so close to the hospital, we had about 15 minutes. But within that time, we were able to mobilize everyone that we needed to not only provide treatment for all of the kids who were coming in, but just as important, make sure that we were able to still function as an emergency department for the patients who were already there and kind of carry on our normal work.
Get the heads up and you go. Why should families have their own emergency plan in place?
Well, just as we spend a lot of time planning, because that is really the key for these kind of incidents, it's really important for families to also do the same. So having a good sense of kind of emergency numbers to call, not only 911, but also your family doctor or pediatrician's number, poison center's number is always important. Having those things on hand, especially if there's someone else in charge, like a babysitter or a family member who's watching the kids. Plans in place for things like possibility of a fire or some kind of structure emergency in your house, doing drills on kind of escaping in case that were to happen, and then also just having a general sense of what to do if we get separated in some kind of chaotic situation.
Yeah, have it down on paper, in your cell phone, you know, somewhere where everybody can see it. Like you said, talk to the whole family about it. It's really important for kids to know what to do too.
Absolutely, and that's all very kind of age dependent. So once kids are old enough, it's very important that they know their full name, their address, and their phone number, because a lot of times when things happen, especially if the parents aren't entirely there, a big function of what we had to do in last week's disaster was try and coordinate communication between families who weren't with the kids at the time this happened, them coming to the hospital, making sure that everyone got safely matched back up again.
Could have been a big fiasco. Everything went very well, so kudos to you all, and all those kids are okay, right?
Thank you, absolutely.
All right, thank you so much, Dr. Redmond. And if you have a question about your child's health, just email me at ltucker@wate.com. And be sure to tune in every Thursday here on 6 News at 5:30 to see if we use your question on the air.